All right, so ever tweaked your hamstring, right? And thought, well, there goes a month, at least. Turns out that might be a little optimistic.
Yeah.
You know, this deep dive, we're getting into all about hamstring reinjury.
Right.
What makes people more likely to have it happen again, and
Yeah.
what this new research found.
Let me tell you, this is not your average study on this.
Okay.
We're talking 300 hamstring injuries
Oh, wow.
analyzed. That's a gold mine of data in the
Yeah.
sports med world.
Okay, so before we get into all the details of this, just to set the stage for us,
Yeah.
why is re-injury such a big deal with hamstrings, and why is this particular study so special?
So imagine this. 1 in 5 hamstring injuries is a re-injury.
Wow.
That's not just bad luck, right?
Yeah.
That's a pattern. We get a crack. And most studies are limited to like 50 people. Tops 300 gives us way more confidence in the finding.
Oh, that is reassuring, because I feel like the last thing you want when you're dealing with one of these injuries is feeling like, oh, am I going to re-injure it? Like, what if it happens again?
Yeah, for sure.
Yeah.
That's exactly where these insights, I think, are so powerful.
Okay.
Because knowledge is your best defense.
Yeah,
Yeah,
absolutely. Yeah, forewarned is forearmed, as they say.
Exactly.
So where do we even begin with this?
Okay, so the researchers here, they got really granular,
Okay.
looking at risk factors
Yeah.
at 2 points in time. So 2 months post-injury
Okay.
and then a year later.
Okay.
And what's fascinating is that the risk factors actually shift over time.
Yeah.
You know, reflecting how your body heals and adapts.
Okay, so it's not one size fits all. It's not the same thing that you're worried about. Except 2 months as you are at a year, that makes sense.
Yeah.
Because at 2 months, you're probably still pretty tender.
Totally.
Yeah.
You're still, think of it like this. 2 months out, your body's like under construction still.
Yeah.
The tissues are, you know, knitting themselves back together. Those neuromuscular pathways are all,
Right.
you know, getting reacquainted.
Yeah.
It's a vulnerable stage.
So what's the biggest red flag at that during those early days?
So they found that discomfort during what's called the active knee extension test
Okay.
was a huge predictor.
Now, already I'm intimidated by that name.
Active knee extension test.
Yeah, break that down for me.
It's actually pretty straightforward. So imagine you're lying on your back, you bend your hip to 90 degrees,
Okay.
and then you try to straighten your knee.
Okay.
It's basically checking how well your hamstring can do its job
Got it.
in a way that mimics like real-life movement.
So feeling pain during that test, that's a bad sign. But like how strong is that link to actual re-injury?
Get this. Athletes who felt any discomfort during this test, any at all, were 3 times more likely to re-injure
Wow.
within that 2-month window.
3 times. That's a massive jump.
It's big.
That's like a little alarm bell going off and you're like,
Well,
you know what I mean?
totally.
It makes you wonder, are we not paying enough attention to some of those
Right.
like subtle signs
It's a great point.
when we're in that early rehab stage?
Yeah. And it highlights, how important it is to listen to your body,
Yeah.
even when the signals seem really minor,
Right.
because a little discomfort might seem like no big deal.
Right.
But this research suggests, you know, it could be a warning sign that you're pushing too hard too soon.
It's your body's way of saying, hold on a second.
Yeah, exactly.
Yeah.
Give me a break.
Okay, so we've got to listen to our body, especially in those first couple months.
Yeah.
But what about down the line, say, a year after that initial injury?
Right.
Does that active knee extension test still carry the same weight a year out?
So it's interesting.
Okay.
The picture gets a bit more complex as time goes on.
Okay.
While that early discomfort is a red flag,
Right.
in the short term, other factors come into play after a year.
So what should we be watching out for at that point?
So time to return to play, or RTP as they call it,
Right.
turned out to be a major factor.
Okay.
And here's a little aha moment.
Okay.
The longer athletes delayed their return
Okay.
to their sport, the less likely they were to have another hamstring injury.
You're telling me patience is a virtue when it comes to this?
It seems to be.
Really?
Every extra day
Wow.
of delayed RTP, and listen to this,
Okay.
decreased re-injury risk by 1.5%.
Wow.
Might sound small.
That's huge.
Imagine that impact over weeks and months of recovery.
Yeah, yeah.
That's huge.
That's a lot of food for thought for athletes who are like
Totally.
raring to go.
Yeah, champing at the bit.
And their coaches
Oh, yeah.
to get back in the game.
It highlights the need for like a more nuanced conversation
Right.
between athletes, coaches, medical professionals.
Yeah.
Because rushing back might offer a short-term win,
Right.
but sets you back even further
Totally.
in the long run.
It's about playing the long game, not just the next game.
Exactly.
Now, besides RTP, what other factors were at play a year out?
So remember we were talking about
Yeah.
those muscles still being under construction even after a couple months?
Yeah.
Well, a year out flexibility seems to play a key role.
Okay.
They found that greater hamstring flexibility, specifically how far you can lift your straightened leg,
Okay.
was linked to a lower risk of reinjury.
So basically, if those hamstrings are still tight a year later,
Yeah.
they're primed for another injury.
That's the idea. It really
Yeah.
underscores
Wow.
how vital it is to make flexibility like a non-negotiable. Part of your routine, even long after you've ditched the crutches and are back to doing what you love.
It's not just bouncing back, it's like building back better, more resilient.
Exactly. And now let's switch gears for a sec and talk about MRI.
Okay.
We often think of MRI as like a diagnostic tool, right?
Right.
But this study suggests it can also give us clues about future risks.
Okay, now this is where it gets really interesting for me.
Yeah.
It's not just, can we see how bad the injury is?
Yeah.
It's what is this telling us about their future? Are they
vulnerability?
Yeah, are they more susceptible because of whatever this MRI is showing us?
Totally.
Okay, I like it. So what kind of intel
Yeah.
can we get from these MRIs?
So two key findings kind of jumped out at me.
Okay.
First, involvement of the myotendinous junction, or MTJ, was red flag.
Okay.
Think of the MTJ like the relay zone, where your muscle fibers hand off the baton to the tendon.
Okay.
It's essential for transferring force, but is also a common weak spot for injuries.
So if that is messed up, if that's
if that MTJ ended up
like a ticking time bomb.
in a way, yeah, the study found that MTJ involvement on that initial MRI
Okay.
was linked to a 3 times higher risk of re-injury a year later.
3 times. See,
It's big.
that's kind of scary because it's like there are these vulnerabilities that you don't even realize are there.
Totally. And this is where I think the MRIs are so valuable, because they're providing a level of detail
Totally.
that we just can't see with the naked eye.
It's like peeking under the hood.
Exactly.
Now, what was the other
Up there.
big MRI finding?
The other one might surprise you. It has to do with edema,
Oh, okay.
which is basically the fancy medical term for swelling.
Right.
Now, you might think more swelling,
Yeah.
more severe injury,
Right.
higher risk of re-injury.
I would think. Yeah.
So here's where it gets interesting.
Okay.
They actually found the opposite.
Really?
A smaller extent of edema on that initial MRI,
Yeah.
specifically when looking from front to back,
Okay.
was linked to a higher risk of re-injury a year out.
Wait, so you're telling me that less swelling
I know, it's so counterintuitive.
could actually be a bad sign? Why?
It's a great question, and honestly, it sparked a lot of debate in the field.
Okay.
One theory is that less visible swelling might indicate a less robust healing response.
Interesting.
It's almost as if the body isn't like sending in the cavalry to lay down the new tissue, reinforce the area.
So it's like a lack of swelling is...
It's deceptive.
Yeah, it's deceptive.
Yeah, it might be masking a potential underlying issue
Wow.
with the healing process.
That is wild. So interesting.
Yeah, it's fascinating.
Okay, wow. What a curveball.
Right. Definitely warrants further investigation, though.
Oh, for sure.
We need more research to pinpoint exactly what's going on at a cellular level.
It's incredible, right? Like all this information hiding in an MRI, like a secret code about how our bodies work and heal. But let's bring this back down to earth for a second.
Okay.
For our listeners who maybe have dealt with hamstring stuff or know someone who has, what are the big, like, takeaways?
Sure. So first and foremost, this isn't just academic. Like, we're talking real strategies for lowering the risk of going through that hamstring whammy again.
Exactly. So let's talk action steps here.
Yes.
What should we be focusing on based on this research?
That active knee extension test we talked about.
Yeah.
Simple check, but powerful.
Yeah.
Especially those first couple months. Any discomfort, clear sign to back off, adjust training, really make sure those hamstrings are ready for prime time.
I'm getting the sense that listen to your body is not just some vague advice.
It's backed by science. Now.
Yeah.
Big time.
Like, actually listen.
Yeah.
It's important. And speaking of science-backed advice, remember that connection we talked about with time to return to play, RTP, and re-injury risk? It's so tempting to rush back.
Oh, I know.
But this study shows just how valuable those extra days, weeks, whatever it is of recovery can be...
I can already imagine athletes printing this study out, being like,
I know.
See, coach, I told you.
I told you.
I wasn't ready.
Exactly.
Data's on my side.
Yes. Data on your side.
There you go.
And it's not just about pushing back on pressure to return. It's also about having those conversations with your doctor, your PT, whoever it is. If you're feeling any hesitation,
100%.
Let's say.
Now you've got evidence.
You've got the data
to back you up.
Yep.
Knowledge is power, especially when it comes to your own body.
So good.
What about flexibility?
Yes.
We talked about it being crucial a year out.
Any tips for keeping those hamstrings happy long term?
Make it non-negotiable, I'm telling you.
Okay.
Think of it as like routine maintenance.
Okay.
For your body. Just like brushing your teeth.
Got it.
Getting enough sleep.
Right.
Regular stretching, work with a trainer, you know, and incorporate it into your routine.
Make it a habit.
It's about playing the long game.
Yes, it's not just about getting back in the game.
Exactly.
It's about staying in the game.
That's it.
Now we can't forget about those MRI findings.
Oh, yeah. Wild.
Seems like there's a lot more to these scans than meets the eye.
Right. Way more than meets the eye.
Yeah.
Like, for example, knowing if that MTJ is involved can be game-changing.
Right.
For rehab plans, it's like having a roadmap. That shows you the potential weak spots so you can strengthen them.
Right.
Proactively.
Proactively. I love that. So much information in that scan. And that whole thing with edema.
I know.
Where less swelling might actually be a red flag.
Wild, right?
Such a curveball. What do you think this means for future research?
Oh, man, it's such an exciting avenue to explore.
Yeah.
Imagine if we could develop even more precise ways to interpret these scans, almost like personalized injury profiles.
Yeah, that would be amazing.
This study is a huge step towards understanding those nuances.
You know, one thing that struck me is this study focused on mostly male athletes.
Right.
Makes you wonder if these findings hold true.
Yeah, great point.
For other groups, women, younger athletes, even weekend warriors like myself.
Right, exactly. So much we still don't know.
Yeah.
Do these risk factors look the same in those populations? What other variables might come into play?
So many questions.
Right.
Yeah.
But that's what's so fun about this, right?
This is like the coolest part.
This is the cool stuff.
It's like it's not even about having the answers, it's about figuring out.
Right, we're just at the beginning.
Yeah, what we don't know. And going from there,
This study gives us a fantastic foundation.
Yeah.
But it's just the start.
It's exciting. There's more to discover.
There you go.
All in the name of keeping people moving.
Come on, let's go.
Playing, doing what they love.
I love it.
This has been so fascinating.
Good, I'm glad that.
Thank you so much for...
My pleasure.
Taking this deep dive with us. You've given us a lot to think about.
Good, my pleasure. Remember, knowledge is power.
Yes.
Listen to your body.
So important.
Key.
Until next time.